As a woman, it used to be that you weren't included in most studies that dealt with vascular disease. So we had the hypothesis that medicines that worked in men worked the same in women, and that women would have heart disease the same as men, but we never really studied it. And now the NIH doesn't even fund studies that don't include women, which is the way it should be. If something is critical for the health of our population, especially in South Louisiana, cardiovascular disease is being evaluated, then it needs to be evaluated in both men and women, and really young and old. The older you are, the more likely you are to have vascular disease. Whether you're a man or a woman, you're still equally likely to have vascular disease depending on the age. So if you're a young woman before you go through menopause, then your risk is less than men. However, if you smoke cigarettes, it offsets that completely. So a young woman that smokes has just as high a risk as a man of developing vascular disease. Now, as you go along, once you get to be about 50, about the time that menopause starts happening, your estrogen levels start dropping and your risk of vascular disease then becomes the same as men. Now, what are the things that we look for in women as far as heart disease? Because sometimes the presentation is a little different. Men typically have angina, which is this heaviness in the chest, sometimes crushing, sometimes just mild or moderate pain in the chest that radiates into the arm or the jaw or the back, associated with shortness of breath. That's the classic symptoms. And that's most men and most women have those same symptoms, but often women can present with different symptoms. They can just be fatigued. They're not able to do as much as they could before. If they used to walk a block without having a problem, and now they can only go 20 feet, something's not right. Sometimes they'll have pain in their jaw, their midsection, their back, or their arms that is a nagging kind of sensation with shortness of breath and fatigue, and that may be all they present with. They also can have palpitations or irregular heartbeats that could be a sign of abnormalities in the blood flow to the heart itself. So when you look at a woman coming in, it depends on their age, it depends on if they smoke, and then you look at the other risk factors that go for both men and women. So menopause obviously has to do with just women, but once you go through menopause, all the risk factors are the same. Smoking cigarettes is the worst. If we could do one thing to get rid of any risk factor, if we could get rid of tobacco, that would be the best thing that we possibly can do. But what are the other risk factors? High blood pressure. Everybody should know their blood pressure, and if it's above 140/90, it's too high. The normal blood pressure is 120/80, and if it's above that, it's actually higher than ideal. But if it's above 140/90, it's too high. Diabetes. As we all are getting older and our diets are not as ideal and as a population, we're gaining weight, then diabetes is becoming much more of a factor. So everybody should know whether they have diabetes, if they're at risk of it, a fasting blood sugar, and then often an A1C level, which is the level of hemoglobin A1C, and that really tells you how your blood sugar is doing over time. If those are elevated, then that's abnormal. Now, if you have a family history of diabetes, or if you weigh more than you should, then those are things that need to be considered. And diabetes alone is a significant risk factor for vascular disease. Any carotid disease, peripheral vascular disease, or coronary artery disease. High cholesterol, and you need to know both your good cholesterol, which is your HDL. In a man, above 40 is normal, in a woman, above 50 is normal. So if it's less than that, it's abnormal, and you try to get it up to as high as you possibly can. LDL, which is the bad cholesterol, should ideally be less than 100. And less than 130 is acceptable, but if you have any significant risk factors, it should be less than 100. And if you have vascular disease itself, it should be less than 70. And then triglycerides should be less than 150. There are also things that we're measuring nowadays called various lipoproteins, ApoB, LP(a), and the plaque. And those things are levels of inflammation in your cardiovascular system as well as your hereditary risk. And if they're elevated or abnormal, then your risk is significant, and that needs to be looked into and dealt with. Then smoking cigarettes, high blood pressure, diabetes, high cholesterol, sedentary lifestyle, and then your gender or your sex. So male gender has a higher risk up until menopause, and then they're about the same.